Bismillahir Rahmanir Rahim. Resin bonded fixed dental prosthesis has other names: adhesive bridges and minimum preparation bridges. It is defined as prosthesis that is glued to the tooth structures, primary enamel, which has been etched to provide mechanical retention for the resin cement. As I said, it is called resin bonded bridges as it is cemented to the tooth structure using resin cement. It is called minimum preparation bridges as it is intra-enamel preparation, minimum preparation. It called adhesive bridges as it is glued to the tooth structures using adhesive systems. The primary goal of the resin retained fixed partial denture is the replacement of the missing teeth and maximum conservation of the tooth structure. The restoration is simple in concept and consists of one or more pontic supported by thin metal retainers bonded lingually and proximally to the enamel of the abutment teeth. These pictures of resin bonded bridges. Development of resin bonded fixed partial denture. Bonded pontic. The pontic is either natural teeth or acrylic teeth cemented to the neighboring tooth using composite resin. As the composite is brittle using as connectors, so it is not widely used and it is used for interim restoration only for short time use. The composite connector were brittle and require support wires or stainless steel mesh framework. Cast perforated resin retained fixed partial dentures, also called macro-mechanical retentive bridges, rochette, is introduced using the concept of bonding metal to the teeth using flared perforation of the metal casting through which the composite flow to provide mechanical retention. Their design recommendation is telling the framework to cover the maximum area of the lingual surface, suggested little or no tooth preparation. You have to do minimum preparation, intra-enamel preparation with a maximum wrap round to ensure maximum surface area for good retention. Use of this fixed partial denture was limited to mandibular teeth or situation with minimum occlusal contact. As I said, it is perforated framework for composite retention. It is macro-mechanical retention. Despite this success, the perforation technique presents the following limitation: weakening of the metal retainers by the perforation, exposure to the wear of the resin at the perforation sites, limited adhesion of the metal provided by the perforation. The second one is each cast resin retained fixed partial denture. It is micromechanical retainers called Maryland bridge, produced by casting the metal retainers and then etching the fit surface by one of these methods, either electrolytic etching or by chemical etching or gel etching. This needs resin with low film thickness for luting. This is a picture of Maryland bridge. Each cast retainers have definite advantages over the cast perforation restoration. These are: the retainer can be thinner and still resist flexing. The oral surface of the cast retainer is highly polished and resists plaque. Ceramic retainers, high strength ceramics, particularly zirconia, exhibit better aesthetics than do metal retainers. In general, retainers can be either metal or ceramic. This is photo of ceramic retainers. This is highly aesthetic. The third one is macroscopic mechanical retention, resin bonded fixed partial denture, called Virginia bridge. It is also called medium mechanical. It involves either using prefabricated plastic mesh or by using low salt crystal technique. In this case, adequate bond strengths are possible with this method, but the thickness of the casting must be increased to allow for the undercut thickness. In this photo, there is a pre-formed plastic mesh. It is going to be incorporated in the wax pattern, and you have your macro mechanical undercut for macromechanical retention. It may be by incorporated of salt instead of this mesh, and it's going to wash out the salt, and you end with the macromechanical preparation, macromechanical for retention. Chemical bonding resin retain fixed partial dentures. It is use an adhesive system for direct bonding of metal for this application. The first of this resin system is a super bond, CMB. Super bond has the highest initial bond strength of any adhesive resin cement. It is followed by bis DMA based composite resin gluting cement called Panavia. Panavia resin gluting agent has shown excellent bond to most of the material used for fabrication of resin bonded bridges. The most recent version are dual polymerization system, chemical and visible light. Direct resin bonded fiber reinforced interior bridges. A new approach is to construct a direct chairside or resin bridges using the acid etch technique to obtain a bond to the enamel of one or both adjacent teeth, if it is fixed fit design or cantilever. In order to enhance the union between the pontic and the abutment, a high modulus resin impregnated fiber material has been developed. Resin fibers can be used directly in the patient mouth or indirect in the cast. It can be the fiber is oriented according to the design. It is fixed fit or cantilevers. Then the pontic is built up. If it is direct, it is going through the procedures of normal composite, acid etching, adhesive and application of the composite. If it's indirect, you are going to do it in the cast, and you are going to cement it using resin luting cement. Advantages of resin bonded bridges: minimum removal of the two structures, minimum potential for bulbar trauma, supragingival preparation, easy impression making, reduced care times, reduced patient expenses, and it is no need for anesthesia. Rebonding is possible. Disadvantages: reduce restoration longevity, enamel modification are required, space correction is difficult, good alignment of the abutment teeth is required. Aesthetic is compromised on posterior teeth if you use metal work. Indication of fixed partial of resin bonded bridges or adhesive bridges: replacement of the missing anterior teeth in children and adolescents, short span, unrestored abutment, single posterior tooth replacement, significant clinical crown length, as it is important for retention, as large surface area is good for good retention. Excellent moisture control, as it is resin luting cement. Contraindications: parafunctional habit, long edentulous span, restore or damage abutment, compromised enamel, deep vertical overlap, nickel allergy. Design concept: the underlying principle for this restoration has always been that it is necessary to cover as much enamel surface as possible. As we have said, maximum wraparound is needed, as long as occlusion, aesthetic, or periodontal health are not compromised. The initial design of each cast retainer include an interproximal wraparound concept developed to resist occlusal force and provide a border area for bonding. The contemporary design has improved retention with well-placed and precise grooves on abutment teeth. In these photos, the first, there is no maximum wraparound and no grooves. In this design, it is less retention and less surface area. In this one, there is a maximum wraparound, more surface area. There is a groove mesial and distal. It adds in the surface area and it increases the retention. This is perfect and good for adhesive bridges. Three principles are fundamental to achieve predictable results with resin-bonded fixed partial denture. These include proper patient selection, correct enamel modifications, and framework design. All these are very important for longevity of the resin-bonded bridge. Preparation of the abutment teeth. Tooth preparation feature for adhesive involve both axial and proximal reductions. Guide plane on the proximal surface with a slight extension to the facial surface to achieve facial lock. The preparation should encompass at 180 degrees edge of the tooth to enhance the resistance of the retainers. As I said previously, maximum wrap round is very important for good retention. Slight chamfer finish line placed 1 mm supragingivally. Usually the preparation is supragingival. Vertical stops are placed on all preparation. This will consist of flat countersink on the lingual surface of the oral incisors or cingulum rest in the canine or occlusal rest seat on premolar or grooves are the resistant feature used in the tooth preparation for adhesive retainers. However, box form may be incorporated if a filling already present. If there is a caries needing filling, you are going to be incorporated as box. Bonding the restoration. Complete resin play an important role in bonding the metal framework to each enamel. Vanilla 21 exhibits excellent bond strength with base metal alloys and template noble metals. It has an anaerobic setting reaction and thus does not set in the presence of oxygen. There is the OxyGuard, which is applied over the restoration after cementation to prevent the oxygen and to make the environment anaerobic for complete setting. Occlusion. The occlusion is adjusted so that there is a centric stop on the pontic and no other contact on the pontic in all excursive movements. The abutment tooth has normal occlusion contact on enamel or the metal casting. Usually the contact must be either in the tooth or in the retainers, but not in the junction between the two. Post-operative care. Because the debonding or partial debonding can occur without complete loss of the prosthesis, visual examination and gentle pressure with an explorer should be performed to confirm such a complication. The restoration can usually be rebonded successfully. If a prosthesis debond more than once, evaluating the preparation and remaking the prosthesis are probably necessary. Attention to the periodontium is important because this retainer's design has the potential to accumulate excess plaque as a result of the lingual over-contouring and the gingival extent of the margin. Calculus removal is recommended with hand instrument over ultrasonic scaler to reduce the risk of debonding. Thank you. That is all about resin bonded bridge.